Hello, welcome in.
Ava, good morning. Uh, Great. So it is 11 a.m. Please note that we are recording and we are about to get started. One moment. Good morning, and thank you for joining the Beyond the Gift Card Community Conversations. My name is Edie Taylor Criddle, and I'm the Executive Director of Healthy Communities Coalition, and it is my pleasure to welcome you to July's conversation. Why don't you, community and faith-based organizations, why don't we partner with researchers? Today's conversation seeks to explore some of those reasons, to look at barriers and overcoming them, and to look at what to consider when entering partnerships, because the ultimate goal is to have great community-driven or community-engaged research, community academic partnerships that serve the community and that are sustainable. We have begun these community conversations since March. It's just amazing that time flies. Can we please advance to the next slide? So in March, in March, we did an introduction to the series and we had dynamic speakers. I'm happy to share with you that more than 65 organizations have either registered or attended these sessions. And that lets us know that this topic is resonating with community and faith-based organizations and that we're on track for something. So keep in mind that we absolutely need to hear from you. We need your input to find out what exactly resonates with you, what topics should we hit on, and then what information can you share as we all come together as just members of the broader community, both residents, patients, researchers, community leaders, program managers, social workers, everyone. In March, we started with talking about research and program design. In April, we talked about research and evaluation. In May, we talked about research and data collection, use and analysis. I think I'm a month off because we're actually in July now. So we started in March with the general conversations. And now today we're talking about community-driven research and the value of those partnerships. What we seek to get from this, what are we evaluating, what are we assessing? We're looking at how many community organizations actually participate in community engaged or community-driven research. Great. We can move on to the next slide. So one of the big questions that we often get is why? Why are we having these conversations? Why do this work? Well, first, it's to create a community-hosted safe space for transparent conversations just among all of us. We're all stakeholders. Secondly, to prepare grassroots organizations to participate equitably in academic community research partnerships. And that equity, you can define, it's unique to each partnership, but it's certainly beyond the gift card. And then lastly, to prepare CBOs and FBOs to begin to drive your own research. You are the ones who understand your communities best. You know where the needs are, you know where the gaps in services are, but there are some questions that you have that you could actually initiate as research. You can engage a researcher to explore your questions deeper, to learn more about your community, and to better prepare you to serve the community. Great. And can we move on to the next slide? So enough from me, right? So now we're looking at community, our conversation starters for today, or just some thoughts. So you can either put in the chat or in the comments when you if you're viewing this video later, sort of, have you ever considered partnering with an academic researcher? Why or why not? And what has been your experience? Either share a benefit of that partnership or concern about that partnership. And if we can move to the next slide. And now I'm going to turn the conversation over to Ms. Jerfa Gerlin, who will begin to talk about the benefits of partnerships and how we prepare to be equitable partners. What should we look for? Thank you, Jerfa. Jerfa is a graduate student from Northwestern University who is working with us, and she has been very diligent in just devoting her time and talents to this project since the beginning of the year, January 2024. Jerfa?
Thank you, Edie. Thank you so much. So before we get started, I wanted to ask, could you please tell me how to pronounce your name? Is it Isa?
Oh, it's Aisha.
Aisha. Okay. Thank you
Yeah.
so much for joining us, Aisha. I just wanted to make sure that I was acknowledging you correctly. Thank you so much for being here with us. So, as Edie noted, we have kind of built these conversations to take place over a course of time, right? And kind of spacing them out. Today, we're going to be talking about community driven, or what we call in public health, community based participatory research. So, if anything seems a little bit disjointed, or it's like, I don't really quite understand this point, don't worry, because it may be that it was something that we discussed in a previous session, and you're more than welcome to ask questions for clarification. All right.
So, Jerfa, if I may interject just for one moment, and I'm sorry. First, I apologize for I always mispronounce it, pronounce your name sometimes. So it's Ashe. Would
Aisha.
you mind Asha?
Aisha.
Okay, great. Would you mind just you joined us today, so you are one of our featured guests. Would you mind just sort of sharing your role and title?
Yeah, of course. I'm a coordinator for the nonprofit SysScript, and we give information to the public about clinical research and the importance of patient diversity.
Perfect.
Awesome.
Thank you.
Yeah. Thank you, Aisha. Okay. So these are non-exhaustive by any means, but these are a few considerations that Edie and I came up with when it came to thinking about principles that are relevant for community-based organizations, faith-based organizations that are thinking about partnering with an academic institution. All right. So we kind of start off by thinking, number one, about the alignment of mission and values. And we want to make sure that all parties involved are really oriented towards the same goals, right? And there's a sense of continuity there. Because if you have partner A who's interested in this aspect and partner B who's interested in something totally different, then you're already kind of skewing the dynamic when it comes to making sure that the partnership is targeted and cohesive. We want to also really ensure that throughout the research process, not just one point or the other, but really throughout, you have this cord of community consent and engagement, which we'll get into a little bit further into the presentation. We also want to make sure that these partnerships are really a kind of foundation for capacity building and strengthening the efforts of the community-based organizations so that they can continue to sustain these projects, sustain these interventions, and continue to do more research should they decide that it's helpful in terms of advancing their organizational mission. So we don't necessarily want it to be a one and done, right? Going to that point, we want things to be sustainable when it comes to the outcomes that we're looking to achieve, right? And we also, I think, kind of tying everything together, want the research process to be transparent and want everybody, but particularly academic partners, to be held accountable for their role in kind of advancing the research and also thinking about ways that they might impede the research, okay? So one of the things that I'll say on this point that I can speak on further in the presentation is that I think many times you have community-based organizations and faith-based organizations, especially from different minoritized groups, who are approached by academic institutions, right? And there's a sense of they are being examined, they are being studied, as opposed to actively being able to participate in the research, shape the research questions, be decision makers, share use of the data, and so on, right? And so wanting to make sure that if there's going to be any kind of collaboration, we're going to be open and clear about what that collaboration looks like from the get-go, and making sure that if there's any deviation from that plan, that we hold everybody accountable to upholding the goals, the missions, and values that we identified from the start. Okay. So this is actually a graphic that I find super helpful when it comes to thinking about the tenets of community-based participatory research. This is developed by a public health scientist named Nina Wallerstein, who's at the University of New Mexico. And one of the reasons why I really appreciate this graphic is that, as I suggest in the title of the slide, it's helpful for thinking about what makes community-based participatory research frameworks different from traditional research frameworks. And one of the things that stand out to me is that you're addressing the issue of power, right? And so to the point that I was talking about before, oftentimes when you think about the kind of research hierarchy, you have community members as like the lowest totem pole, right? Like you have them as research subjects. And you have the academic researchers, you know, the members of the kind of ivory tower at the top. And there's this discrepancy in power dynamic when it comes to engaging with one another, right? Sometimes it seems like the interests of the community or the research subjects are not being honored, and research then in itself is being a very extractive process, right? Where you have the university come in and they study the community and then they leave. And they take the data with them and they write these papers and they do whatever it is that they're going to do. And you have the community kind of left going, well, what about us, right? And so I include this graphic to suggest that people in public health in the field itself are recognizing that the way that we've traditionally done research, especially with minoritized communities, has not been effective and in some ways has done harm. And so they're trying to think about ways to do things differently. Okay. So let's go into these 5 considerations. Now, we'll start off, like I mentioned earlier, kind of thinking about the missions, the values, and the way that I kind of tie that back to research is really thinking about what it is that we are researching, right? So in a previous session, one of the kind of simpler definitions I gave of research is that we all conduct research in informal and formal ways. You know, you having a question about something that you see, I don't know, on the street, and then Googling it, right? As a means of seeking out answers. That's an informal way of conducting research, right? And so I think what's important for any kind of partnership, whether it's a partnership between a CBO and another CBO, a CBO and an FBO, a CBO and an academic institution, you name it, is that all parties are clear exactly on the research problem, right? What it is that they want to gain more insight on, and also really the aims of the research project and any intervention that they propose to develop, right? And as you'll see in the second bullet point that I have here, it's important that these are shared among all partners, right? It can't just be the case that community members say, well, we want this, we think this is really important, and the academic partners say, not so much, because then it doesn't necessarily make a good pair. You want to make sure, as is true in the nature of partnership, everybody is on the same board, right? Everybody's on the same page. One mistake I think that can be subtly made in these partnerships or attempts to be kind of partnered equitably is that there isn't room left for flexibility when it comes to potentially revisiting the research plan. So in a kind of grounded theory approach, you might say, for example, let's say you work with a community-based organization that is centered on nutrition, right, for example, and developing more healthy eating and promoting healthy eating and lifestyles for urban youth, right? Just kind of thinking of a random example, right? But let's say as you're partnering with an institution like UIC and their School of Public Health, you realize, you know what, we've surveyed the youth, we've conducted community forums, and you know what, our project needs to shift. You know, what the youth are telling us is that they want to focus on something a little bit different. It's helpful to have that kind of open communication with the academic partners and say, you know what, maybe we need to go back to the drawing board and kind of revisit what it was that we thought was important, because the community is telling us their priorities are different. And if it is the community that we ultimately want to serve, as far as going back to that mission, that shared set of values and aims, we want to make sure that our research project is reflective of what it is that they think should be researched. So let's get into an example. So here's one such example. And I've tried to pull these examples from different Illinois or greater Chicago-based community-based organizations to show that, other colleagues, broadly speaking, are kind of thinking about this work. So here's an example. You have a community-based organization that is focused on housing insecurity and homelessness. And they're going to partner with a local university program, let's say it's in public health, that researches the efficacy of various housing first programs. Why does this make sense? Why does this seem like an effective partnership? Well, for one, the fact that they're both interested in solving or addressing homelessness, presumably in the same locale, right? Relatively local. And they have a targeted interest in policy in these various housing first programs suggests that they're already on the same page, right? Their mission and values are aligned, right? And they're aligned in specific ways because they already have a research aim. They want to better understand the efficacy of these different housing first programs. So that's one such example about how you bring people together, not just based on the fact that we're a community-based organization, we're a school, we do research, but you're really making sure that it makes sense why you guys are coming together to do the research together.
So, Sherfa, I love this point. First, I love the consideration that you offered in terms of the common mistake and being able and being empowered as a community partner to actually go back to the researcher to say, okay, the community no longer wants this, or how can we adjust it? Can we go back to the drawing board? I think that's critical because sometimes as community partners, I think we view the relationship in these academic community research partnerships sometimes like doctor-patient. And we want to get out of that mindset and realize that we are equitable partners and that the power is shared. But I think to your other point on this slide, I love this as well. It shows a great alignment. But I think there are community groups who may not know where to start. Like for instance, I'll go to, and I'm sure they're everywhere, but there are basically centers for every population in some way. Would you agree? Like there's a Center for Adolescent Health. There is a center that focuses on gerontology. Is that a fair statement?
Yeah, I think that it's fair to say that there are a lot of agencies that have like targeted demographics in mind in terms of who they want to serve. Yeah.
So not the agencies, but at the university, the research centers as well.
I see what you're saying. Yeah.
So, and I think that that's something that perhaps the community groups may not be aware of, that when you call, the university, that more likely than not, you can reach a center that actually conducts research on the population you serve, on something that either on the population directly or on an issue that impacts that population. And that's what I just wanted to add.
Yeah. Yeah, I think that's helpful when it comes to thinking about the power of networking, right? And recognizing that just because you have this big university like nearby, like at your disposal, doesn't necessarily mean that it can't also be difficult to kind of figure out, to your point, like, okay, where do I start? Who do I reach out to? Who's doing what? Are they even open to collaborating? How do I get a meeting on the books, right? And so I think something that community-based organizations are also tasked with is doing their research on the potential partnership.
Absolutely. Absolutely. I agree. Absolutely.
Yeah. Okay. Ready to move on to consideration number 2. So this consideration is one of my favorites, and I really thank Edie for bringing this up, because I think there's a difference between saying, okay, we've identified our mission, we've made sure that we have an aligned set of values, and also saying, okay, now what do we do to get started, right? And I think the first consideration is more so kind of theoretical, in terms of thinking about the nature of the partnership, what we imagine things to look like. But when you move into the second consideration, when it comes to determining capacity, when it comes to assessing the existing supports and resources that you have, that's how I think you move towards the actual doing, right? The actual work of the partnership. right? And so it's important, I think, to realize that regardless of whatever stage of development the CBO is in, or the population or populations that they serve, or the issues that they work on, every community, like this idea is grounded in community-based participatory research, but every community has assets. Every community has resources that they can leverage. I mean, even when it's coming to expertise, like Edie was saying, right? You know your community best. And so I think what I appreciate about consideration too is that this encourages you to kind of think internally, like think within. What is it that we can do for ourselves, right? What is it that we're doing well? What data do we have about ourselves that already exists? What resources do we have that already exist? And then conversely, where are there potential gaps? You know, when we're looking to go ahead and build this partnership, what do we expect to come out of the partnership? What are we expecting the academic institution to help us fill in or to help us do? Right? What areas need attention within the scope of our organization or our work? And so there are, again, non-exhaustive list, but different ways to do this. So there's this thing called assets mapping, which is helpful in terms of visualizing on a map where physically certain resources are located within a community, whether it's schools or hospitals or green spaces, you name it. Surveys, polls are also very, very common throughout social sciences and behavioral research, literally just polling the community, right? Getting their feedback asynchronously. Focus groups are also important. Focus groups, community forums, right? Kind of inviting the community at large to participate in this kind of community-wide conversation and getting everybody together in the room, as opposed to like sending out a link to a survey that people kind of complete on their own. And then more formal needs assessments, which are oftentimes done in partnership with programs in public health or academic researchers. And so this is an example of what I was talking about with that assets map. This is coming from a community-based project from the University of California at Los Angeles. And what I like about this map is that with the legend, you can tell exactly what it is that this particular kind of research group is prioritizing when it comes to thinking about resources within this particular neighborhood in Los Angeles, right? And so they have a basic needs section that's represented by a palm. And you'll see that kind of scattered throughout. And another thing I should say about the map too is that the visualization piece here allows you to recognize what resources are clustered where. So for example, the red cross that you see symbolizing healthcare, you see that that's kind of concentrated in one specific area, right? Kind of like the upper left quadrant of the map, right? And that kind of then makes you think about, well, what about the people near East Rosecrans Avenue, right? Like what do they have available to them in that area? Because we don't see as many of the Red Cross's healthcare, hospital, clinic signs there. Looking for the smiley faces for mental health care and counseling resources. How many do we see of those in the entire map? Not many, right? Wow. And so that's another thing that we can use as visual data that helps us think about what do we have? We have some, but where are we lacking? You know, quite a bit, right? So this is just one example of what that kind of assets mapping can look like.
Okay, so Zerfa, can we talk real quickly just what a potential? So here's what I'm thinking about. I'm thinking about two organizations which I am familiar with, and they both are offering youth programming. They have different programs happening, and they both aim to prevent violence, youth engagement and violence. And so if we presume that they're in an area like this map is depicting, and you see the resources or the assets, if we notice that there are more assets near one as opposed to the other, located where there aren't any, any mental health care or counseling services, or any healthcare facilities. What types of research projects, could you give an example of one or two, could that youth program conduct?
Yeah, so I think that youth program could be really successful in conducting some type of community forum, for example, and getting the youth engaged in a collective conversation. And one of the things that I think would be an interesting talking point is to get their perspective, right? To understand how they perceive the discrepancy between, let's say, the resources existing in this cluster of the neighborhood as opposed to theirs. So one of the things I might ask them is, you guys, are you commuting to this part of the city or this neighborhood to access this resource? If you aren't, why? Is it because you don't necessarily feel safe going through certain neighborhoods? Is it because you can't get easily public transit there? Is it because when you go there, you feel like you're treated in a way that's somewhat discriminatory? Is it because the services that they offer there aren't necessarily culturally specific to your needs and they're not speaking to what it is that you're looking for help with, right? Because we also have to remember that just because a resource exists doesn't necessarily mean it's effective or equitably distributed or used by everybody, because everybody's needs are nuanced and different, right? And so what I like about the utility of the community forums is that you get everybody together in a room and you have a conversation, not just with the leaders or the researchers, but you also have an opportunity for the community to talk to themselves because everybody's in the space together, whether it's virtual or whether it's in person, right? Another way
Absolutely.
that you can think about it is like a town hall, right?
Mhm.
So there are different names for very similar kinds of tools.
So I know we've been talking about the possibility of looking at mental health, looking at in the area of grief, looking at mental health as and grief support groups as violence prevention. And so on a, although this data isn't relevant to the areas I'm thinking about, I mean, this map isn't, we're going to use this sort of as our, as our case right now.
Yeah, yeah.
So, and also presuming that these providers are doing what they say they do, because to your point, then, I'm envisioning there being an opportunity to conduct research around even looking at the violence intervention, the rates of violence of those programs that are receiving the mental health counseling and services versus that program that isn't. And I think that would be very telling, especially for the program that's not connected to any mental health providers.
Yeah.
Just to identifying the needs of that group and seeing how well a project like that could work. That's just what came to my mind, because that grief support program is just in my mind, right?
Yeah.
It's still swirling around. Ashe, right? Does this overlap at all with your work? Do you have any insight or anything to add regarding this consideration? Because I know, as you mentioned, you're working with clinical researchers and communities, sort of. Can you speak to either?
Yeah, so our main focus is the community, is the public, especially like my department. We don't really work with like the professionals. So it definitely, having those partnerships is definitely something that we're working on, especially now that we've moved to a new model, whereas before we would kind of do our own events. Now we're looking into partnering with different patient a patient focused
Advocacy.
like groups, and then different, like community organizations. So, and then one of the things that's always on my mind is kind of, okay, having these partnerships is very important, but then after those events, how to, continue these partnerships. That's something that we're always looking into, um, you know, because it is kind of difficult once everything's kind of wrapped up, and to kind of find different ways to extend that partnership, or continue it, because I think another problem that maybe communities face, and that's something that they've talked about, is like, well, like these researchers, these groups come into our communities, and then once their job is done, they kind of leave us. And so that's something that's my focus, how to continue that partnership.
And I think that's when we look at these considerations and we look at the community's role, when we begin at an equitable place or we're driving it, then the odds increase that the interventions are sustainable.
Yeah.
Because they're not going away once the researchers leave. That's our premise.
Yeah. Okay.
Okay, Jennifer.
No, I think this is good. I think it also helps connect the dots between these examples. So we looked at the assets map. Here's another example that I pulled from CPS, Chicago Public Schools. So before starting a study looking at educational outcomes in a low-income neighborhood, there's a faith-based organization that hosts, like we talked about, a community forum to discuss the purpose of the research, the proposed methods, and the impact with the residents, right? And so what I highlight about this as a particular example is that you're using from the community forums, the participants' responses, the feedback from the forums as data, right, as qualitative data. And this already helps to shape the research design to make sure that you are already really kind of building in the community's priorities into the way that you're doing research. And so again, this is a screenshot of a registration kind of link on CPS's website for exactly what they did, right? A community forum back in 2021. So again, local examples to show you that people are actually doing this, right? They're taking theory and then applying it into practice.
No, I love that because it looks like that faith-based organization, whoever is leading it, is also very in tune. Power of research in the community.
Yeah.
Wow. Yeah, that's wonderful. Okay, I will add this because it's such a sensitive position to be in. Whether you're a leader or a clergy, but because it's a trusted position, and so we have to make certain, because we're approaching this topic of research, that it is done in a fair and equitable manner, and that there were opportunities such as these forums to offer feedback and to help shape what this looks like, to help empower us as community members to not only get involved, but to stay involved and to understand the benefits of research.
To be sustained in your involvement, for sure. Yeah. Okay. So let's look at our third consideration. Okay. This one may seem a little bit like a duh moment, like this may seem a little obvious, but the reason why I think it's important that we consider it is kind of like what we talked about with the first consideration, is that research priorities, research kind of formats, research studies, I think when it comes to community-based participatory research, should embody some level of flexibility. And so because of that, I think it's important to communicate the aims of the research, the purported study, the design, the purported impacts that you expect to have, making sure that you communicate all of that and any potential changes in a way that's clear to the community, right? And so I think because many community-based and faith-based organizations may not have formal training in research, even though I did say earlier that we all do some type of research, right? They may feel somewhat at a disadvantage when it comes to the graphic that I included to the right, thinking about the theory behind research, right? Making an observation of a particular phenomenon, identifying patterns, developing a research question or hypothesis, developing a theory, developing a study to then evaluate that theory, right? And so on and so forth. Many CBOs and FBOs may feel like, look, I'm not sure how to do that. That's not necessarily within my scope of practice. And so I feel like part of that clarification process, the task is up to the academic partners to make sure that they're helping make that process clear. Because it may be clear to them, but not necessarily the people that they're working with, right?
I'm a little antsy over here because this really hits home for me. It really does. I think basically to speak in layman's terms so that we understand, don't use acronyms, without explaining them. I just left a meeting prior to this conversation, and every time they use this, and I should know it by now, but still, like when you're talking about methods, the Adelphi method, I'm like, oh, I gotta look this up again, right? But everyone's not going to do that because we're not all researchers in the room.
Yeah.
But I think there's a presumption that we are, but I'm like, no, we're not. And I have to often raise my hand, like, okay, wait, I have to understand what the method is. Why do we use this method? Why are we doing a randomized control trial, or the other words, then what are the other options? So I think just to that level, so maybe a quick one-on-one session or introduction to terms or something before entering these partnerships, so you're clear and not totally reliant on the researchers. So there does have to be some homework done on the community partner side.
Right, right. And I think to your point, Edie, it's the fact that you've had so many experiences like this reminds me personally in my own practice of why it's so important for me to learn how to communicate and disseminate information to a wide audience, right? And making sure that the research that I'm doing helps the greater community and not just my fellow researchers, right? Like I want to make sure that it's clear, I want to make sure that it's generalizable, and I want to make sure that it's accessible so that people can actually use it and do something with it, right?
Absolutely.
Using technical jargon and just speaking to other researchers isn't all that useful when it comes to thinking about the greater community, because we're not all researchers, right?
Absolutely.
But we all have something to benefit from the kind of scientific process and the research process, right?
Absolutely. Thank you.
Mhm. So here's one example, and this is pulled from UIC. They have a partnership for health promotion, and this is something that I pulled from one of the pages of their website. So an academic institution, in this case UIC, is partnering with a faith-based group to study nutrition and health, kind of broadly construed. But as you were saying, Edie, this partnership includes training, right? Like you were saying about that one-on-one for the community members and participants on how to collect data, teaching them how to interpret the results, right? So then you're not necessarily just extracting the research from the community, but you're showing them what to do with that information. You're showing them how to use it in their own sense. And the plus side of this is that this helps to build the community's own capacity, or the community-based or faith-based organization's capacity, right? Because it's helping them meet a need that maybe they didn't even think of identifying, which is how to take on certain aspects of the research process themselves, right? So that even if and when the academic organization says, okay, we're moving on, we're taking on another project, the community or the community-based organization already has the methods to replicate this process, right? So they're learning something, and it's not just the academic partners taking and taking and taking. The community is gaining something when it comes to methodology or these different tools, right? And so at UIC, they have a partnership for health promotion that seems to be doing or trying to do just that. So again, local examples, people are actually doing this, taking theory into practice right here in Chicago.
That's wonderful.
Okay. So the fourth consideration, we're almost done. We have 5, so we're on the 4th one. Now, this isn't, I think, really a consideration so much as it is a reminder that trust building, rapport building, any kind of connection building is a process. And I think some of the things that we've talked about, like the accessible communication, the consistent communication, really making sure that the community voices are elevated and really centered, are important. And I think even under the best of circumstances, that doesn't necessarily mean that there will be trust established right at the outset, right? Because it takes time to build those things, right? And so all that to say that research can be a very time extensive project in and of itself. And throughout the course of that time, right, whether it's several months, whether it's several years that you're developing that partnership, so too will trust be built, right? I want to kind of give an example or really emphasize why I think this is an important reminder, right? Like the necessity of trust and why it takes time to like earn trust, right? So there's a nonprofit in Chicago called Chicago Beyond, and I love referencing them because I think they do excellent work. And one of the things that I really love about what they do is that they have put together this guidebook, and there's a screenshot of it to the right, called Why Am I Always Being Researched? And it's an interesting guidebook. It's available in English as well as Spanish. It's free. It's a PDF just on their website, but it actually includes tools of building trust, right? And it gives you some historical context working with different organizations in Chicago that serve different populations on why trust hasn't always been an easy thing to earn. I'm not just going to say gain, but earn from community members, right? So I would definitely recommend that as a resource if you're interested more in what it means to actually build trust, like what actions are needed to actually begin that process and to sustain it, right? And so this is also pulled from that guidebook, Why Am I Always Being Researched? And one of the things that they kind of really beautifully identify is that when it comes to developing any kind of intervention, if it's not based on trust, if it's not based on being equitable from the start, right? You have this discrepancy between engaging the community in a way that's meaningful, because there's a difference between being included and being belonged, right? Like belonging in the actual research process. There's a difference between having a seat at the table and feeling like you should have a seat at the table, right? And so I love this quote to the left, and it says, people say if you're not at the table, you're on the menu. But it's more than that. It is how you are at the table. If you don't decide what's on the menu, if you are invited after the menu is set, you are still a guest. We as researchers get funded to be hosts, but in truth, the community should be the hosts and we are the guests. And this is coming from a professor at UIC. So again, thinking about shifting the power dynamics, right? And when it comes to thinking about the shifts of those power dynamics, the kind of tangible outcomes of that is thinking about sharing authorship for any publications that come out of the research, right? So including members of the community-based organizations as co-authors on a paper, thinking about how they're accessing the intervention or the data, right? To what extent they continue to own that, right? Thinking about what information is shared in any kind of outward-facing publication, right? Thinking about accountability again, right? Let's say there's an intervention that's being co-developed, but there's a funding lapse, or a member of the academic research partnership kind of pulls out of the team, right? Thinking about then, how do we regroup? How do we remain flexible so that this intervention or this programming that we're trying to develop can be a success? How do we then go back to this program and say, okay, how can we evaluate its impact? What support are we going to need to do that? Right? So going back to the community and making sure, like I've said before, they're involved at all stages of the process, right? They're not just like what this professor is saying, being seated at the table. They help decide what's at the menu, right? And they're not invited as last minute guests either, right? As a matter of fact, she flips the script and says, the researchers are the guests. They're being invited into the community space.
It's really amazing. I love how the professor describes it, in terms of the researchers being the guest and the community members, just not being the guest, but also what you just added about this last minuteness, because often or not, although I do believe the dynamic is changing. I think there's more focus on equitable partnerships and ensuring that we are both on the community side and the academic side, that we are striving to work together, that we're striving to work together equitably. But oftentimes these large grant announcements will come up, these large funding announcements, and then there's a struggle or a big rush to get community partners there, and however the plan is already set. So I think to your point, and also for anyone who's listening, as community partners, that's where you really have to take a look at these considerations and not be rushed because the institution is under a deadline to submit the grant.
Yeah.
And, and they're pushing, they're pushing their data. And it's not to say it's wrong, but that you must make time to look at the data, to look at whatever they plan to assess, to see if there's any benefit, to make certain any benefit for the community at large. You want to ask questions about being able to sustain it. What would be your role after the completion of this study?
Yeah.
How will they disseminate the findings back to the group so that you can continue to build?
Yeah. Absolutely. And build in a way that doesn't necessarily tokenize members of the community either. Right?
Absolutely.
So let's move on to an example before we go into our fifth consideration. So this is actually a program from what's called the Northwestern Settlement House. They have a slew of sponsors, and as the name suggests, Northwestern is one of them. They've been in existence since they've been in existence since late 1890s or the early 1890s. So this example here, a research project examines the impact of after-school programs in underserved areas. And that term underserved could mean a host of things when it comes to different populations you're working with. The academic partner, for example, like Northwestern, commits to helping the community organization secure funding to continue successful programs even after the study concludes or the partnership, I don't want to say dissolves, but maybe kind of slows down in terms of what they're working on together, right? And one of the reasons why I really like this, and I put this image in the slide here, is that this goes back to our point about sustainability, right? And not necessarily coming in to do a one and done, because we know public health doesn't necessarily work like that, right? We want to make sure that what we're doing can be continued and there's continuity of care and continuity of services so that we don't just say, okay, we tackled the issue and then we left and put a Band-Aid on it when we really didn't get to the source, right? We also want to make sure that in terms of sustainability, the programming that we're doing is generative so that we continue to serve multiple generations, multiple cohorts of students, multiple kinds of youth, multiple kinds of demographics, multiple kinds of neighborhoods. And it's not just, okay, we went here and did this and then we left, right? And one of the big ways that things get done in terms of the research world, or maybe the world in general, is with money, right? Lapses in funding are oftentimes responsible and make the difference between a project being made feasible and a project not being made feasible, especially when you think about the fact that a lot of these community-based organizations are nonprofits, right? And many people in community-based organizations also work other jobs in addition to taking on these leadership roles. They may, for example, want to bring on a consultant or a guest speaker, and they have no way of paying that person. They may want to bring on a research assistant, but maybe are dissuaded by the fact that nobody will want to work for them if they can't necessarily offer them compensation, right? There are a host of reasons of how money factors into things, right? And I know that can be somewhat of a difficult topic to talk about in public health because we know just how unfair marginalized communities, especially when it comes to low-income communities, have been treated, right? And the poor health comes that come out of class struggle and low income and poverty, right? But it is just a kind of clear reminder that part of being sustained in the work that you do is having the resources like money, like funding, like grants, for example, to do that work and be generative. So it's not just a one and done. Right? Thoughts on this before we move on to consideration 5?
I think you did a great job of summarizing that.
Okay, awesome.
Yes.
All right, great. Okay. So this is our last consideration, number 5. And so by no means, again, like I said in the beginning, is this meant to be exhaustive, right? But I think in terms of kind of rounding out the principles that we've been talking about, it's important to ensure that any intervention or program that's being designed centers the community's interests and needs. And this is kind of a summary of what I've been talking about before when it comes to addressing power dynamics, however subtle they may be, and continuously engaging community members throughout the research project and not just phase 5, right? Not just inviting them last minute to the table, but helping them decide what's on the menu, right? What's to be served at the table. Another thing that I didn't have listed here on this slide that's coming to me as important is that I think for academics, one of the main ways that we kind of get our information out and disseminate it to the world is via academic publication, so papers. And we submit to these things called peer-reviewed journals. But oftentimes community members aren't reading them. Even if they wanted to, they don't necessarily always have access to them because they're behind paywalls. Right? So like I, as a graduate student, because I go to Northwestern, have access through the Northwestern Library that pays for me to have access to these journals and download the articles and save them and all this kind of stuff. But the average person, that may not be the case for them. Moreover, I recognize too that for different populations or for working on different issues, a paper isn't it. You know, what are they going to do with the paper? right? That may be
Mhm.
useful when it comes to knowledge generation and teaching in the classroom, but on the ground, I mean, that paper, academic paper, may not be useful. And so also thinking about when it comes to centering the community's interests and needs, also think about what would be useful and impactful for the community as an intervention, right? The academic paper is kind of like the standard, in terms of we do research, we write about it, and then we submit it to a journal and it gets published. But then think about to what extent that's serving the community, right?
Mhm.
And going back to the research problem that they helped co-develop with you, right? Is a paper, for example, going to solve the issue on the, I don't know, example of the faith-based organization that was focused on nutrition and health,
Mhm.
right? Like really making sure that what's coming out of the partnership is not just serving the academic researchers, right? But it's actually a way that is advancing the mission of the CBO. And so
Absolutely.
one example that I
I'm
have,
sorry.
oh no, 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 that's okay. That's
Oh, no,
okay.
I just want to add here, because what you're making me think about is, especially in the example of the faith-based organization that's working around health and nutrition with its congregation, is not just advancing the mission of the organization, but also advancing the health of that population. Because if you know what I mean? Because if you're finding that I don't know, that the number of new diabetes cases, have decreased significantly compared to another church. Then we're talking about establishing best practices in these disadvantaged or marginalized communities who are often faced with similar demographics. So if some intervention worked well in this area, why wouldn't we promote it in all areas with these demographics so that we can improve our health?
Mm-hmm.
So
Mm-hmm.
I'm thinking like that's the power of it. That's the transformative power, I think, of ensuring that these interventions are are community driven, you know, to different extents, but are community driven. And then that we're sharing the information through the dissemination. And just to your point, outside of the journals, what could dissemination on a broader
Yeah,
scale look
yeah,
like?
absolutely. Yeah. And so I think as part of developing a tool to answer some of these big kind of systems level questions would be in developing an MOU or a memorandum of understanding. And the way I like to think about the memorandums of understanding is that they're somewhat like quasi contractual, right? They're not necessarily written in blood per se, but I keep using this word that I started using in the beginning, which is flexible. They offer, in my mind, a kind of blueprint or template or sketch of what the partnership is going to look like. But
Mhm.
as part of developing that MOU, you have, for example, periodic meetings to check in, right? And determine that the kind of outline or the structure of the MOU is actually satisfactory to both partners and true to the way that the research collaboration is progressing. And it also offers you, for example, through these periodic check-ins or reviewing the MOUs before all partners sign, it allows you the opportunity to flag any potential concerns when it comes to the way something is worded, when it comes to the way language is used, when it comes to maybe how a particular process or phase of the research study is outlined. You have this physical document or digital document, and you can say, no, we're going to edit this part here, right?
Mhm.
And then you have something tangible to review as a resource and share among all community members or all members of the nonprofit and members of the academic team so that you can build consensus. And so as you continue to progress through the research process, if there's any questions, you can go back to the MOU. And it's another way of holding everyone accountable.
Absolutely.
I want to be mindful of time because on my watch, it says we have 6 minutes left.
We do. We do. Great job. And
Oh,
we went through we went through all 5 considerations.
so let's just kind of move through the slides and see if there's anything else. Oh, we're right here, Q&A and conversation. Wonderful.
Perfect. 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 Perfect.
So like I mentioned, it was a lot of information, and some of these points were kind of building off of previous points from earlier conversations and earlier meetings. But we'd welcome any kind of impressions or any thoughts you'd had on what we presented today.
Absolutely. And if you're watching this video later, please include your comments. Please include your comments in the, not in the chat, but in the comments field. Because we'll post this both on the website as well as on our YouTube channel. And we will often revisit them. We'll be alerted. There are other opportunities. If we can advance the slide, there are other opportunities to get involved. If you are a community-minded researcher or social worker or other stakeholder, a caregiver, if you're a community or faith-based organization, we are looking for members to serve on the Research Advisory Committee to help us develop content. We look forward to having in-person workshops soon. If you're interested in being a panelist or a presenter, and that's for, again, both community and faith-based organizations, other stakeholders, as well as researchers. We also are looking to do dissemination lunch and learns. So if your findings focus on any of these marginalized communities, we have a range of partners from youth programs to environmental health programs, to senior programs, to arts-based programming. If you have any research that you think will be relevant and you're looking for an audience, please let us know. Great. And with that, we will want to thank you, Ashe, for attending this with us. I'll tell you that SysScript, am I pronouncing that correctly?
SysScript, yeah.
The organization, they were one of the first organizations that I contacted regarding putting together these Beyond the Gift Card community conversations. So I'm really happy to see you join us today.
Thank you.
Thank you, Aisha.
Thank you. This was
Thank you
very
as
helpful.
always, Jirfa,
Good. Awesome.
just for your diligence. I think this was a very good session. Jirfa, she created the slides, the examples, and I think they were on point. So thank you very
Awesome. I'm
much.
glad. Yeah, for sure. For sure. Thank you.
Great. Well, ladies, I am headed into a noon meeting, but I look forward to seeing everyone next month. And then we will just keep going from there.
Yeah, that sounds good. Thank you so much for joining, and we're glad that it was helpful.
Thank you.
Okay. Thank you. Take care now. Okay.
Take
Bye-bye,
care.
everyone.
Bye-bye.